AABR was founded in 1956 when 6 parents who had children who were blind and had developmental intellectual disabilities, known at the time as mental retardation, got together and said we needed to build a future for our children. So they formed an organization, a not-for-profit organization, that began to advocate for services for children and their children, and hopefully build a life for them. And it's embodied today in its mission, May Each Life Find Meaning. In 1966, AABR opened up its first school for children with visual impairments and intellectual and developmental disabilities. In 1974, 2 years after the Willowbrook scandal broke, AABR opened up its first residence. There are now 22 residences throughout 4 of the 5 boroughs of New York City. We also operate a day program where we have training in rehabilitation skills, pre-vocational skills, and all adult life learning skills. We have family support services in all 5 boroughs of New York City. We have a drop-in center that is a self-advocacy group that meets regularly. We have a Saturday recreation program, and probably one of our true gems is our school, the New York Child Learning Institute, where we serve 25 children and adolescents with autism. This is a replica of the Princeton Child Development Institute, which is a renowned, preeminent school in New Jersey, working with young people and children with autism. It's a great program. Our principal, Dr. Susan Venner, is affiliated with PCDI, and we receive certification from them. And it has helped so many parents. And in their words, their own words, which are the best, it has provided a positive transformation for their children. The People First 1115 waiver is OPWDD, the Office of People with Developmental Disabilities, venture to help transform the system in New York State. They're currently in agreement with and discussions with the Center for Medicaid and Medicare Services in Washington. This waiver really is attempting to meet the challenge that we're facing in our field over the next 5, 10, 20 years and beyond. Clearly, New York State has developed services throughout its last 40 years that have really focused on developing each individual's talents and each individual's capacities. But clearly, it has been at a great expense, and New York State is looking to be able to manage the future because we have so many individuals who have autism that will be coming into the system. We have individuals who are aging that are still being served in the system, and this is going to hopefully allow them to help us manage the costs going forward to make us much more efficient. What is the great unknown about the waiver is exactly how it's going to work, and so clearly there's a lot of work and a lot of negotiation that still has to be done to make this work. And many of the agencies in providing services, as well as the parents and individuals with disabilities, are quite concerned as to how this is really going to work. So we're going to hopefully continue to partner with government to see whether or not we can get the future of services secure and set, and still provide the necessary resources for all. Upon reading the series of articles in the New York Times and the Poughkeepsie Journal on the state of services for people with developmental disabilities in New York State, it was, albeit with mixed reactions. Clearly there were tales of abuse and neglect, funding inconsistencies, unexplained deaths, and clearly this challenged the system in terms of how it approaches services. There were certainly clearly truth in the stories that were told, but unfortunately the sad part, I believe, is that we might, as a field or as a service system, get painted with such a broad brushstroke that all the system needs to be reformed and changed. So many of the good things that are done on a daily basis did not get captured in those stories, and that is also the large part of what the truth is about our service system in New York State. We truly have grown in the 40 years since Geraldo Rivera walked into Willowbrook and exposed the rampant abuse and neglect. In any human endeavor, are there mistakes? Are there problems? Will things not get done properly every day? Of course. And we have to take those stories that the Times gave us and make those stories better. Clearly, one element, in addition to the individuals being served, is the story of the direct support professional, who really are the front lines of what we do. And if there's anything we could take from those stories, is that we need to honor them and prepare them and support them better. Our direct support professionals are on the front lines. They're the ones who have worked with the individuals every day and provide the protections that are necessary within the confines of their daily lives. And hopefully, as we start and hopefully as we go forward, we can look to support our direct support workers better. The Direct Support Professional Alliance of New York State has been advocating. One of their code of ethics one part of their code of ethics is to honor the people they support. And I think what we have to do as organizations and as with our government partners is honor those direct support professionals by giving them proper training and education, hopefully some credentialing along the way so that they feel like professionals, and most importantly, a living wage. In terms of our development, it is a great challenge these economic times. I think every organization, every business is faced with the tremendous strains that the economy has placed upon all of us. Our shrinking government resources. During this past year, we've experienced close to $1 million of lost funds and resources. So clearly that puts a greater strain on our hopes for the generosity of our supporters. Well, you know, it's interesting. I've been very fortunate to be able to come to AABR in 2011. And I think in terms of a surprise, it's been a surprise for AABR because their longtime executive director, Christopher Weldon, retired last spring. And Chris was a marvelous and visionary executive who helped develop programs, services, and supports that have maintained a quality of excellence throughout it all. And I've been very, very fortunate to be able to come in after Chris and have some pretty big shoes to fill as I've gone forward and try and face the challenges that AABR has, as well as our whole service sector. AABR is a wonderful organization, and while that has not exactly surprised me, it has certainly confirmed my initial thoughts about what a great organization this is and what a great organization it can be as we go forward. I guess some of the surprise was the press coverage, but even with the surprise of that, as we know, I've been in the field for 35 years now, and clearly you see what works well and what doesn't. And I guess what I continue to be surprised at is the level of dedication of the staff, especially here at AABR, supported by a great board of directors and our board president, Audrey Sachs. A great management staff and clinical team. The maintenance drivers and support staff all care about what they do, and certainly our direct support staff that give every day. And that continues to pleasantly surprise me, and it makes me proud to be here as their executive. I think firstly, our biggest hope is our moving into the digital world here at AABR. We've been lucky to team up with a software firm out of Denmark called Team Online, and we are at this particular point developing programs that we're going to work with our direct support staff and our field staff to try and track all of the data necessary for supporting the individuals we serve. So clearly we are very excited moving forward with it, and we're in development stage now, and hopefully putting out online shortly the programs that we have and taking our agency forward. Well, as it's been some rocky times at sea, I guess my final thought is I'm hoping to have some clear sailing ahead and some smooth seas. Clearly we will need to rise to the occasion with our shrinking resources, with our dramatic changes in the service sector. But clearly maintaining excellence in service is what has been the hallmark of AABR. They believe in the people they serve, and I believe in this mission that may each life find meaning.